At some point in most of our lives, we've suffered from some form of pain.
Whether it be from a chronic headache, joint pain, or a debilitating back condition.
We're excited to explore all the intricacies of pain management
on this episode of the Caribbean Network.
Take me back to the Caribbean, take me back to the Caribbean, take me back to the Caribbean, take me back to the Caribbean. The place feeling nice and breezy, yeah. The vibes feeling cool and breezy, yeah. I feel a cool breeze, a nice breeze, fresh breeze, Caribbean breeze.
Welcome to the Caribbean Network, where we highlight Caribbean-owned businesses here in the Metro Atlanta area.
We've partnered with Cariblingo Clothing to bring you today's episode.
Today we bring you a Caribbean talent, Dr. Fitz Harper, a practicing physician here at the Urgent Pain Management. Dr. Harper, welcome to the show.
Great, thank you for having me.
How are you doing today?
I'm doing just fine.
So tell us a little bit about your journey, from your heritage to how you became a medical practitioner. Your hero's journey, if you will.
Well, yeah, it's interesting. You know, very humble beginnings like most of us. You know, we have good parents who raise us to do right, you know, in everything we do. And it's interesting to me when I'm asked that question. You know, growing up in Guyana, I thought I was going to be a cricket player. But when I came to New York, I figured I had to do something else. So at the end of the day, going to school and early on had an interest in medicine. Don't really know where it came from, but stuck with it, pursued it. Complete family support to get to the end of the journey. My entire practice has been here in Atlanta for 28 years now, so here we are.
Okay, cool. So Dr. Harper, you mentioned you grew up in Guyana, you left Guyana, you went to New York, right? Give us some more detailed explanation on that journey to becoming a physician.
So I had a school project. I was probably in the 8th grade, maybe 9th grade.
Okay.
And somehow ended up with a skeletal model that to this day is still in my mother's closet in Brooklyn, New York. And so whatever the prize was I wanted for, and sort of that's where the journey began. When I went to high school, went to Clark Barton High School in Brooklyn, which is a high school for health professionals. It's probably one of few those type of schools in the country. Ultimately on to Howard for undergraduate education.
Okay.
And after that, worked for a chemical company for a couple of years as a chemist. And ultimately medical school, Philadelphia, training in Philadelphia. Came back to New York, did an internship, and then finished up anesthesiology residency in Philadelphia prior to coming to Atlanta. So my first job was at Emory University as assistant professor of anesthesiology.
Oh, wow.
And at that time, started doing some interventional pain management, but the latter part of my career have made a complete shift the majority of time with patients dealing with painful problems of the joint, spine, headaches you mentioned earlier, and other painful symptoms.
Okay. Much like any medical ailment, you often don't know or fully understand the conditions until they personally affect you. So with that being said, what exactly is pain management, and what situations would lead someone to needing your services?
Well, it's exactly that, pain. You know, most people at some point in their lives hurt for one reason or the other.
Right.
Most of us will get a problem with our back or shoulder or knee or ankle. Whether it's acute or chronic, develop over time. You go see a physician, you start off with medicines typically, maybe some physical therapy and other types of supportive care.
Right.
The big area of focus for our practice, what we do is deliver medicine by injections to the point where the problem is.
Okay.
And so with the use of a fluoroscope, which is an x-ray machine, we specifically target medicines to where the problem is.
Right.
And it's really a comprehensive approach. That's a big part of it, but painful syndromes often need emotional help for one reason or the other. And so where I think we are a unique practice. First, we listen, and we listen very intently to each and every patient.
Necessary.
Yeah.
And then secondly, we take complete responsibility for your pain care, in that if there are things that other providers can provide for you, we take the responsibility of finding those people for you and making sure you get those additional help that you need.
Okay.
Wow, interesting.
Very interesting. All right, Dr. Harper. So there are many approaches to pain management, physical therapy, and rehabilitation, right? And you mentioned a bunch of them earlier. Could you elaborate on those approaches that you all offer here and what makes it different from other practices?
Well, as I said earlier, it's a comprehensive approach to treating a painful problem.
Okay.
And if you are a practice that focuses on just medication management, that's really all you're doing. You're treating the pain, but you're not treating the underlying problem.
Okay.
And our practice approach is geared to understanding why you're hurting.
Gotcha.
And until that point, we can't really determine what are the best approaches for you.
Right.
And the comprehensive part will require therapy of some kind, acute and or chronic. Another important feature is that you as a patient have to participate in that care.
Definitely.
If we can reduce pain, but all you want to do is go home and lay in the bed, then you're wasting everybody's time and you're wasting your time, right? And so the whole idea is that you take an active part in what you're doing so that you can move normally. For me, there's nothing more rewarding than if you bring in an older family member and they're having with a walker or a wheelchair or whatever the case may be, and you can effectively relieve that pain so now they have better function. And if they like to plant in the garden, then they can go out and do that. If they just want to walk with the dog down the block for a couple days a week, that's an important goal.
Okay.
And so we spend time understanding too, what are people's goals when you come in to see us, right? What would you like to do that this pain is preventing you from doing? And we work together to get them to that point so they have a better quality of life.
Right.
And that's really the end point.
Okay, gotcha. Definitely.
A lot of these pain, if they're chronic pain, the reality is that they're episodic, so they will come back at certain points.
Yeah.
But the more, and you have flare-ups, and so the more that you're taking an active part in that process,
Prior, like
prior
getting to the nitty-gritty.
continuously, right? When you get up in the morning, if you don't take a few minutes to stretch, it's going to hurt.
Right.
And so you have to do a lot of those things along the way. My goal and our goal as a team is to help you manage that a lot better and improve your quality of life.
So you basically want your patients to be proactive as well.
Absolutely. We're not the type of practice who we're going to spoon feed one, but two, we're not the type of practice who are going to write large number of narcotic medications
Right.
and have you go home and feel good, but still have a painful problem that's not being effectively addressed.
Right.
Now, there are times you need to have some medicines along the way, but if you can bring the doses down and enhance that with some therapy and injections that we do, then it's a good combination for you that you can function on a regular basis.
Okay. Sounds good. Sounds really good, yeah.
So as a Caribbean person myself, some of my, best memories were childhood, growing up in Trinidad, So what would you say are your fondest memories growing up in a Guyanese household?
Well, I left Guyana, I was 12 and a half. And so
Still, you had 12 and a half years.
Well, I'm saying I was 12 and a half. And, back when I was in Guyana, in the early 60s to early 70s, as a kid, young boy, for us, the joy is being able to leave the house in the morning and not come home till it's time to eat. We ran and played the whole time, and whether it was, stealing the government sugar cane or whatever the case may be, that was the order of the day.
Yeah.
School was an important, serious thing, and so we all had to do our part in that. And you know how it is. Growing up, when you got in trouble, well, everybody knew about it.
Right.
And so not only they were still beating us back in school back then. So
right.
when you got
we know about that.
Yeah. Yes.
So but it's the foundation that helped me to understand how to view life in a positive way. Family is the most important thing. It still is. And they've been the foundation and the soul of everything that I do. And so from that standpoint, they've at least provided me a background
Right.
that to succeed, without which I would have
proper
otherwise had.
foundation.
Yeah, absolutely.
So you rep Guyanese. You
Oh.
rep Guyana.
Absolutely.
Okay.
Absolutely.
Who's your favorite cricketer?
Well, you know, that's back in there when Clive Lord.
Yeah.
I marvel and I tell folks still today that from a professional team standpoint,
Mm-hmm.
cricket is the only sport that had the longest run of a national type championship with the Caribbean team playing
Yeah,
the world
yeah.
10 years running. You know, that's
Mhm.
pretty phenomenal. When you think about football and basketball
Yeah.
today, you know,
Yeah.
they really don't compare to that.
Yeah.
That is true. All right, Dr. Harper. So let's envision I require medical treatment from your practice, right? So I've run track for over 20 years, right? So and I've acquired a lot of injuries over those years. So an injury that I used to get a lot used to be my hamstring. I used to pull them every single time, usually my right hamstring. What type of treatment, equipment, amenities would you provide here for someone like me?
Well, like any other patient,
Mhm.
as I've said earlier, the important first step is understanding what the injury is.
Right.
And the majority of diagnoses you can get from a thorough medical history,
Mm-hmm.
physical exam.
Right.
And there are instances when you can't get enough information, particularly if you're not responding to some initial therapy where we may need to do some imaging, such as an MRI,
Okay.
to help define the complete anatomy, where the pull and or tear may be,
Okay.
and first ensure that you're not doing things to make it any worse.
Gotcha.
The therapeutic modalities, you know, if you've had many of them, again, you come in, you can get a lot of variety of different treatments, whether it's vibratory things, heat, massage, but there are things that you have to do. And a hamstring is one of those things that you have to take your time and not come back too quickly,
Right.
or else you make it worse. But that's a perfect example of what I said earlier,
Mm-hmm.
in that requires you to do some work,
Oh,
right?
Be proactive.
Right,
Yeah.
and you got to be proactive in terms like if you're going out running and you're preparing for this event, well, if you don't take the time to stretch,
Yeah.
you put yourself more at risk.
Right.
You know, when you look at a cat in the morning, what's the first thing to do when it wakes up? Stretch it.
Stretching. Yeah.
Our brains are not wired that way. We get up in the morning and we go. Well, if you know you have a chronic problem, then you're obligated to yourself to behave differently when you start your day in the morning. So that when you have episodes, they're less frequent, they're not as severe, and you recover faster from them.
Okay. All right. Sounds good.
Okay, so I heard you're gonna give us a tour of the facilities. We're excited to see.
Absolutely.
And you know what? Seeing that I had a chronic issue back in the day,
Yeah.
I think you should give me some proactive
Oh.
things to do. So yeah.
Okay.
Yeah.
You want a
Come
little
on
rub
back.
down?
Absolutely. So this is an example of one of our chiropractic therapy rooms where you get conservative management for musculoskeletal injuries.
Okay.
You asked me earlier about a hamstring injury. These are the type of things that we begin to do here. You know, adjustment tables, things that you would do here with rubber bands and other things in the practice, and as well things that we show you to do at home.
Okay.
Again, you taking an active part in your recovery as well.
Also, like so let's say for instance you do some stuff here, you have to ensure that the patient does it at home as well to follow up.
Correct.
Okay.
I mean, it makes sense, as I said earlier. Is
Yeah.
that, again, if you just want to come in here and do a few things
Mhm.
with that hour session every 2 to 3 times a week, and
Yeah.
then go home and lay around, it just doesn't work that way.
Yeah.
Yeah.
And you know, you're not a sedentary type person, but if
Yeah.
you imagine someone who is not used to exercising their lives or not being active, it just perpetuates whatever problem they're dealing with, and it makes it more difficult to treat.
Okay.
So this is where our listening continues to patient.
Okay.
And then we take time to explain our findings from what you tell us, take time to explain our findings from a physical standpoint, and we take time to explain the procedures.
Right.
This is a skeletal model. that looks at various places in one's lumbosacral space, whether it's low back, upper back. We do epidural injections by a variety of different approaches.
Okay.
We do injections in the sacroiliac joint, and many other things that we can do up along the spine for back pain. And back pain can be due to a variety of different things.
Right.
From the surface to just below the skin in terms of muscle, soft tissue type injuries, to bony type problems, and deeper structures like the nerves.
Okay.
If you get a pinched nerve, we've all had that occasion when we bang our elbow and you get
Yeah.
shooting pain down our legs. Well, if you got disc herniated in your low back,
Mhm.
the same thing occurs. And if it's severe, it can progress to numbness and ultimately weakness, which
Right.
is what you don't want to have happen. You treat those things appropriately.
Okay.
Okay. So we need to know, is this your model from the 8th grade?
I wish it was. Well, it was a little plastic model that just had some basic structures on it, but it got the job done. right?
Exactly.
Exactly.
You're here now.
So, yeah.
It got you to where you are, right?
Absolutely,
Exactly.
Absolutely.
All right, cool.
All right, so now you're in my sweet spot.
Ooh.
So this is really where I do what I do to treat a lot of these painful injuries that we talked about,
Okay.
acute or chronic. And we do it in a very targeted manner, so we know we're putting medicines exactly where the problem is.
Right.
And so there's no question if I do something that patient doesn't get a relief, then I'm not wondering whether or not I put the medicine in the right place.
Okay, gotcha.
And so this is a patient that needed an injection in their knee
Mm-hmm.
for degenerative arthritic disease that was painful. And as you can see, you know, the femur, tibia, fibula, middle of the kneecap is usually over here. And this is a needle coming in.
Okay.
Contrast material, so I know that it's going where I want it to go.
Right.
And whether I'm using steroid medication
Mm-hmm.
or platelet-rich plasma
Okay.
or even a regenerative type of medication,
Mm-hmm.
I can put it exactly where I need it to go. If I needed this to go over here, then I can do the same thing, or any particular part of the knee. So now I'm putting it where the problem is.
Bring
Right.
exactly this.
Exactly where it is.
It's not like you're guessing.
Yeah.
You
I'm
know
not, and that's it.
exactly
I'm
where you're going,
removing.
yeah.
I'm removing that element on it because my goal is high success.
Right.
Right.
Right. And so once we can do that and get effectiveness, then we can continue that path. And if this is not going to work for the patient, then we're going to know because it doesn't work for the patient.
Gotcha.
Not because I put it over here or somewhere else where it's not going to be effective.
Yeah.
Right.
Gotcha.
And so the table is, as you see, it's a table that accommodates the C-arm. You either lay on your back or on your side or sit up at times, and we get the right angles. Sometimes we have to take 2 or 3 different angles to make sure we get things where we need to.
Right.
And again, this is where we help people get their quality of lives improved.
Do you have to be put under to have something like
Great
this?
question.
Okay.
95% of the times, no. And I wouldn't
Damn.
say under, I would say lightly sedated.
Okay.
And there's some people who just can't tolerate needles.
Right.
Right.
They hyperventilate, they sweat, they scream bloody murder.
Absolutely.
But everyone, you know, it's done with local anesthesia,
Right.
superficially in the deep tissues. But in those instances where we need to give someone something to relax, put an IV in,
Okay.
and we give them a water-soluble form of Valium called Versed.
Okay.
And you're in good hands because I'm an anesthesiology-based physician.
Right. Yeah, you did say
So
that. Yes.
that's what I do, and so is my partner. And but it's conscious sedation where you can still communicate, but have the element of anxiety removed while we're
Right.
doing the procedure. Most of these procedures are very quick. The time it takes, most of it is really prepping in terms of isolating the area, drawing up medications, prepping it from a sterile standpoint.
Yeah.
Right.
And the actual injection itself takes just a few minutes, sometimes seconds.
Right.
Okay. So let me ask this question. So when you do administer an injection like that, like, is there any what's the lag time between the patient leaving here comfortable?
Well, we'll have patients who will just hop up off the table and walk out. But from a safety and requirement standpoint, we also want to have them sit for about 10, 15 minutes at least so you can observe to make sure there are no side effects.
Right, yeah.
So we check for that. After they go home, we'll call and follow up and see how they're doing within 24 or 48 hours.
Okay.
Cool.
Because, you know, our first requirement is always first do no harm.
Right.
And so we ensure that you're trying to get the desired effect every time that you do it.
Okay. Sounds good. Sweet spot. There you have it, folks. Urgent Pain Management, a medical practice specializing in personal auto injuries, rehabilitation, physical therapy, regenerative medicine, all across the spectrum.
And Dr. Harper, on behalf of the Caribbean Network, we would like to present you with a little gift for having us today. On behalf of our sponsor, Cariblingo Clothing. Ooh.
Oh, wow.
That's all you.
Awesome. No, this is cool. I like this.
So now you can
Perfect.
rep. Now you can rep
Absolutely.
for real.
I can rep for real now. That's very thoughtful of you guys. Thank you so much.
Of course,
You're
of
very
course.
welcome, sir.
And really thank you guys for coming out and spending time today and help us to showcase urgent pain management, and that we can very easily be accessed at one of our 4 locations in Roswell, here in Decatur, Hapeville, and Stockbridge.
Okay, do you have a website?
Yes, it's urgentpainmgt.com.
Okay.
And of course, there's a phone number that centralizes and takes calls from incoming patients, which is 404-500-1675.
Okay, awesome.
Folks, you all get the information, right? You have any types of pain, any types of stuff like that, come see him. So Dr. Harper, here at the Caribbean Network, we have a slogan, right? And the slogan is, your network is your net worth. How would you say that impacts you over your years to lead you to all this success?
Well, it's the core of how we stay connected and make new connections, and we can build and grow from there. Today, with all of the different social mediums and the way that we communicate with each other is very different from 15, even 20 years ago. And so when you provide good service to a person and they have a friend or a family member or a colleague or somebody that have a similar problem, and if that was a good experience for them, then the hope is that they will make those connections for you, which you can't really put a price on.
Yeah.
Priceless.
And so, again, it goes back to what I said earlier about providing attentive and quality service to people. And if they get a good outcome or at least enjoy that experience and it's successful for them, then they're going to share that with someone else.
Correct.
And a huge part of our patient base is simply personal referrals.
Wow.
We're not yet on social media. We do have a website, but it's more informational for patients. It's not yet used as a marketing tool.
Right.
And so we rely a lot on the personal referral
Word of mouth.
from what we provide to patients. Now we do go out and do some direct grassroots, if you think we will, from a marketing standpoint.
Yeah.
But it still comes back to how we treat that person one at a time when they come through our doors, and the impact that they get. Are we a perfect practice? Absolutely not. But the feedback allows us to do better the next time.
Oh, definitely. Yeah, you have it, folks. So, folks, on behalf of the Caribbean Network, we would like to thank Dr. Fitz Harper again for having and hosting us today, sir.
Well, thank you much, and I enjoyed it.
Guys, don't forget to check us out on all social media at The Caribbean Network, and check out our website at www.thecaribbeannetwork.com. So I'm Makila.
I'm Benzo.
And this is
The Caribbean Network.
And now, it's time for the Cariblingo Word of the Day.
And now it's time for the Cariblingo Word of the Day. And the word of today is
Forehead.
forehead or forehead. The space below your hairline and above your eyebrow, if you have a hairline. Right? Yeah, a little bit.
They use forehead in Guyana, Jamaica, St. Vincent, USVI, all over the Caribbean. Forehead, forehead, what we say?
Forehead.
Forehead.
Yeah, forehead. Your forehead. Have a hairline, so have a little forehead. Yes, folks, the Cariblingo Word of the Day. Alright.
back to the Caribbean, take me back to the Caribbean, take me back to the Caribbean. The place feeling nice and breezy, yeah. The vibes feeling cool and breezy, yeah. I feel a cool breeze, a nice breeze, fresh breeze, Caribbean breeze. Gotta get away, yeah. Oh yeah, I've been locked in, tuck away, yeah. Gotta get loose, gotta break free, yeah. I need to feel a West Indian breeze, yeah. I gotta fill up on my culture, reconnect to my structure. Feel that energy, that love, that rush ya. Rejuvenate so I can get you more substance. Take me back to the Caribbean.